readmit our patient ourselves again. Same patient. Does everybody remember where you start? Mary?
Reception.
Reception. We have to receive. We have to receive first. Reception.
Is this a walk-in again, or?
Yes, we'll do another walk-in.
You said you were doing the same name.
Same name as what you did previous. Yep. Will be a new visit.
Continuing to create a new account and put OK there.
I think so.
New visit.
Search. Get patients in? Get them in?
There. Everybody have a screen that looks like this?
Not quite yet. New. I think they're all there. I think so. Oh, Cheryl, are you there yet?
I am now.
And then pass.
Okay. We're going to verify the date of birth, remember? Our chief complaint this time is going to be laceration. Laceration in your chief complaint.
LAC.
Put down.
Or
Yeah,
you
you can do that.
Doctor.
Yeah.
Put your ED provider and your ED nurse in.
Is that okay? Put your provider and your nurse in. Over there on the side.
After they get admitted, will their primary care provider show up automatically? Or no?
I believe it probably will if that's inputted in.
Okay.
Yeah. Should carry over. Everybody ready to go to, where do we document from the triage, or, well,
Triage.
yeah, go ahead and
Save
click
that.
save.
Same.
Continue.
Just a minute. That's okay, but you can keep going. Yeah, it's just that you got your complaint. So Mary, okay, now you.
This is so polite. You may go to open
No.
chart now and start other order sets, or you may go back. No thanks, maybe later.
Somebody commented on that yesterday.
Maybe, okay, maybe you just make sure you're ready for it. Or just jump to wait for the show. Okay, now, you okay? You went too far? Okay.
So are we opening chart to order page down?
No.
or-
Nope, we're gonna go back to it later.
She's on the tracker. Cheryl? Tracker? Okay.
Everybody see your name now?
No. Cancel? Cancel. You don't have people to change it.
Okay, highlight your name on the tracker.
There. Go to tracker.
And where are we gonna go
Go
next?
to your next
Triage.
She said it's. Okay.
We've already put our chief complaint in through our reception routine.
Tracker.
So what will we document through the triage tab?
Allergies and all that.
Yep, allergies and home meds.
No. What are you gonna do?
If you have allergies entered, which you should from the last visit, I want you to go in and confirm the allergies again.
Did you get lost?
Oh, it didn't add.
Maybe take your thing on the side.
I did.
Did you? Yep. And you didn't, were you in there before? I'll just try to get it. Okay, try it again. She said we can't be lost. So maybe we do up down, these little girls on both sides.
verify them?
I did.
Okay,
But
click
not
edit,
that.
Should we go
Yes.
here?
and then audit.
Well, I'm there, but when I saved it, it didn't add me, so I'll just go through again
Okay,
and
it might be double.
Yep.
see what.
That's it.
Okay.
Cancel. On it and then,
Yeah, you can cancel out
Save
here.
it. There you go, go back in.
Enter it, but
Confirm.
No.
Are you doing okay?
oh, I did that.
Well, I know you can't do it.
yeah, we'll just save it.
Yeah.
If the cat can't read it.
Click on
Okay. Kate had to redo, because she said she lost herself, I don't know.
Well, I have two of them in mind, so I opened the other one too, so.
No thanks later, right?
Yep.
Okay,
No thanks.
that's what I did.
Yeah, I'll save it.
edit
There's a scroll bar on the left-hand side. You'll probably have to
That
find
lied
it.
to you.
Yeah, 'cause I said that, yeah.
Yep.
and
That's what I
I can
learned to do this time, this stuff.
Just pick one and stick with that one,
Okay.
and then I'll go in and clean out your other one.
Yeah.
Yep, that left-sided scroll bar, it'll get you every
Yeah.
time.
Well,
Did everybody go in and review home meds also?
Oh, no.
Home meds?
Honestly, put one in.
If you don't have one, you should have one from last time, but.
It just didn't show up on the other part once I clicked.
Right. If they are supposed to display on that home screen, but they're not, and their Meditech is trying to fix that. So go in and confirm your active home meds.
ever have it?
Oops. Let's take it.
Excuse me.
Yeah, you do it on all your
On
minutes.
your right hand side column, Marcy.
Confirm. Okay, okay.
I'll save this.
Did you confirm on that one?
If you go to your edit and then audit, you should be able to see your confirm on your audit trail.
So if they look
I
on
can't do it, so we're
You
right
know,
now.
Confirm.
Right, you just stay right where you're
That's
at.
confirmed, yeah, so that's confirmed, it's right up there.
Yeah.
Okay, so you got one confirmed, right? So I don't know what happened with your confirmed, maybe we need to do it again, huh? Are you on allergies or the home meds? We're doing home meds, right?
Yep.
Home meds, you're going to allergy, okay, there you go.
So I need to click these, right?
Yeah.
Click confirm.
I did this 3 times.
I don't think it will.
Because
It's
you
gonna
know, on
stay
here,
in
see.
verified, but say, go ahead and click edit and then click audit. And it should show that it's going to confirm.
No, the two
Yep.
bottom ones are there.
Yeah, 1346,
Yeah.
1348.
Those are earlier, so
I've
you're
done
okay.
it, I've done it 15 times.
I know. I think you're doing okay, Mary, are you doing okay, do you feel like it's okay?
I think so, it says confirm.
Yeah, you got both of them there now. Uh-huh.
So I
You
save it then?
Go to,
Good.
did you click confirm down here?
Yeah.
Yeah, okay, so if you go to audit, oh wait, sorry, go back to edit mode. These are still highlighted green, so yes, click save. Cancel that, I don't know why that is.
Keep on the,
Now go to edit and then audit, you should be able to see your
on your
confirm.
little blue things there.
There you go.
This left one, you can see it says number.
Okay.
I don't know why some do.
Everybody go in and confirm here their audit of their medications.
Cause I do my own medication too, but I hate that.
Okay, so go ahead and click back into that triage tab.
sign there?
From the triage tab, this time we're gonna choose to launch into the flow sheet, the ED flow sheet, to start documentation on this laceration. So go ahead and check mark the ED flow sheet,
Right there, the sign there.
and then down at the bottom, click document.
At this time, would you be able to click on all those and then they go into those?
You could click,
Oh, right
click
there.
them all if you'd like. The only caution is if you click them all, it's gonna take a while to load,
Okay.
because it's gonna load all of that data.
Okay.
So go ahead and fill out your ED flow sheet.
Where are you supposed to be? Trina. No, right here. And then, put you back? Okay, maybe.
Okay.
You get it, okay, just so you can catch up. Is there easy working stuff? That's it, okay. And then document. You'll have exactly the same thing. Well, if you went on the, we can go, I'll show you, just get you, keep it going, okay? Working okay? Cheryl, maybe what you
Yeah.
doing, what's the problem?
Well, I got to that part of it.
Okay.
No.
What?
I said there's still a lot of typing in it.
If you're done typing, just sit there, Cheryl.
I need to be typing about this.
Oh, you gonna do some things? No, if I. Well, she's in a different one, because she had that looked out, I'll show her when she gets done typing. It's the same assessment.
Why does it seem like on this one there's more, like I don't remember doing on the last one, the Gaz-Locoma scale or anything like that.
The one we did before was just a scheduled ER. This
Okay,
is actually
okay,
the first
an
time
ER.
we filled out that ED flow sheet.
Okay, that makes sense.
Yeah, I wouldn't do that.
How are you girls doing? You need help, Karen?
Oh.
Doing okay?
Do you notice how your pain location or your blood pressure location from your previous visit is defaulting in? It's not supposed to do that. That's another fix-it that's in with Meditech. Ideally, when you start with a fresh patient, you should start with a fresh chart without carrying over those instance types. So, I'm hoping by the time we go live, they'll have that fixed and we won't have to. There's a workaround, you can actually go in and inactivate the one that's defaulting in and then enter in a new one that's applicable to that visit, but it's not technically supposed to be carrying that information over from visit to
Okay,
visit.
now if you go to triage. Do you have triage on yet?
No, for some reason.
Okay, go back up to your tracker. And then
There
go
we
to
go.
triage.
Okay.
Okay, and then it'd be right here,
Now.
see, that's where, because you got lost.
But that's the same.
It's the same, it is.
Okay, does
Just wants you to
everybody
be there.
display a last done here on your ED flow sheet? So we all documented on that, and it says it's been done?
Does it say it's done? Hey, oh, you went back again.
I was just looking at it.
Oh, you're just. Is it not, it is
Yep.
documented? Yeah, I think we're all,
Can we click the pain assessment since we already did that with our flow sheet
oh, you have to click in
Click it, what do you mean?
To get it off.
to get it off our
No,
work
because
list?
we wanna do another pain assessment prior to
Oh,
discharge.
okay.
So we'll wanna keep that on
What
there.
about the Glasgow?
Yeah, that's
We'll
done.
wanna do that again at
Okay.
discharge
there. It's
too.
done. Okay, all right, we're ready.
All right, so we're gonna go in now and open up our chart.
Excuse me.
Okay, you'll see some red start items.
What do you
Does
work
anybody
with?
remember what those signify?
We have to document on them.
Right, how did they get on the work list?
So do you work
Is
with
it
Mary?
the order set?
So do you work with-
They're
Or
through the
what?
chief complaint.
Yeah.
Because we picked laceration, these are the interventions that are associated with that chief complaint. Now, with this patient presenting with the laceration, say their bleeding is controlled and there's no need to apply direct pressure, we can go in, even though it's attached to the chief complaint, if it's not applicable, which for today we'll say it is not, we can click on the status due and cancel that one out if it's not applicable.
Which one do you want to cancel out? I'm sorry.
The apply direct pressure.
Now, how do you- how
Our
do you
bleeding
stop?
is controlled for this scenario,
Got it?
Yeah, you already took it out.
okay?
Do girls do okay?
The other one that I'm seeing on here, we can probably remove for a laceration, if it's just a simple laceration, would be the IV fluid drip titration flow sheet. Most of our standard lacerations don't require an IV. So we can go ahead and select status due on that one and cancel it off our work list. Okay?
Put the IV one off.
Now let's go in and do a more focused assessment on that laceration. So click on the document now column in the laceration assessment and click document. This first option you have to choose from is an actual body image. So if you click the drop down, you'll get a picture of a body.
Go back again.
Right up on the
This
location
drop
up
down
there?
right here.
I don't have one.
I don't.
Me either.
Oh, you don't have an instance type put in. You need
Oh.
to select, where is your laceration located?
Oh, yeah, you gotta put a location in. Use.
So go, do what?
Yeah.
Like how you add your blood
Signify
pressure
where your
location.
laceration is.
So how do I get back to that?
All over.
Go ahead and click on new skin location
Location.
and click the drop down.
Yeah, click it again, because we need to rest.
There you go. Now tell the system where your laceration is located.
Okay, now plus again. See, there's a drop down. There.
Click OK.
Concentration assessment, add a skin location. Just, you gotta click on the skin, then
Here.
yeah, just click on, and there you go, no problem. Where was your laceration? One,
Everybody get your instance type or your
Okay.
location.
okay,
Uh-uh.
now, pick out where your laceration is.
There you go, just
So-
select a location.
And then save.
When I click on it, it makes me move my.
Click on your drop down,
Did I do it?
right there.
Down, I'll show them up here. When you click on that drop down,
No, I want you to do it.
the key is down here for what you want to do on the picture. So if you want to point to something, if you click on the arrow box
Maybe, is it two?
and then hold your mouse button, left click down and drag the direction you want the arrow to point and release, it will place an arrow on your image.
You just hit OK and then
Oh, we didn't put okay.
click what you want.
Yeah.
So
Do it again.
left click, drag,
So we save.
there's your arrow. Does everybody get that?
Yes.
What
No,
is it?
no.
Oh, on right
There
you go.
Where?
Left click, so go ahead and point to where your location is. Where was your
click. Right on.
right on, okay. So you're gonna wanna start back a little ways from it. Push the left click and drag down. Then release.
Yeah, see that little thing there?
Over it.
What is that, mark or you can do these things?
Oh, shoot, it's an arrow. It's kind of backwards. It's actually start to turn and it's drag and turn. So if you did right leg or left leg. Oh, it didn't do the arrow. Okay, so you're gonna start away from the direction that you wanna point to.
Now start
Hold the left click button,
wherever and then
drag it, hold, and then release.
cancel.
And that'll put an arrow.
So go like right
Try
here.
that.
And that's fine. And click your left, now drag it. Cancel.
Did you get that, Marcy?
So, and drag to where you want. Oh, and then I canceled it off.
Yeah.
Okay.
Go ahead and
Chart.
copy.
So is
There
that
you go.
And I'll chart where we're gonna
there?
put. Put something there.
Do I need it right on it or?
No, it doesn't have to be right on it. If you just want it to be pointing to. The other thing you can do is actually draw a line on the body. So if you want to say, here's this little line button here.
1 inch.
Yeah.
Say you have a laceration on the thigh, you want to draw a line here. Say, whatever,
Bone protruding.
3 cm, black to left thigh. Click OK.
Did it work okay for you? Did you do yours there?
Put it right on his butt.
Is there anything else you need to add? Okay, front dash,
I still got my arrow on
and
my.
that's the CM, so you put like the one.
That was so frustrating. Where's the lines?
CM.
This the other one. I canceled it.
Alright, and now, we know this, blah, 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 blah. And I don't know if she wants.
But I still got it. Did you write what it was?
For making sure.
Oh, 3 cm laceration.
There, you should again on it.
Okay, pencil, she's trying to bob it,
I can't get rid of the pencil.
you can't get your hand to draw, you said?
You did that.
Oh, you already did it, cancel.
I still got my. How do you get rid of that?
Okay, so now we're gonna put out.
Whoops.
Oh, that's a
The
cancel.
second one.
So I don't know if it's squared,
See, I did the arrow.
did the X take it out?
It's, here's my.
Edge and pencil, will the X take it out? If you click on the X.
Just
I
makes
don't
it.
know.
What did you
Or like, what you like, you wanna take it out?
If you put it in and you wanna remove that,
There's an edit down at the
Okay,
bottom.
so you
I
added
haven't
it.
really done a whole lot with
Edit.
editing.
So got that. that's what I want. I just push
There
okay.
you go, yes. We haven't really done, so you did the location, the laceration, is that, it's right, or figured out?
I mean, it's off the hand.
Means you're pointing off the hand.
Pointing to it.
There you go.
So you wanna change that, Mary? Is that
No, I
still
don't.
okay?
It's just coming up. Do I need to do
No,
anything?
I don't say, no. Usually they want the one link, and it's in CM, so you put a number in there. And this is where you would do the suturing and stuff for what the doctor does, okay?
So I'm gonna go back to where I'm at.
Go ahead and click OK if you wanna save it. And then you can document.
Yeah, this is okay. Say no, and then you can just put it in.
At this point, we have not closed the laceration, so
Yeah,
we aren't gonna document closure.
No. So I'd say, save what you got, okay, if you're happy with it. Okay, Cheryl, you're still okay then? Okay, then.
Everybody get their laceration documented on? Okay, now we wanna notify the provider, we have an ER laceration. Where are we gonna capture that? Does anybody remember?
ER time.
ER time. So document now.
Document. Finish up.
Provider
Yes,
in-house,
remember?
no,
So on the side
notify
there,
that
put down
now.
document. Your check mark. No,
Emergency medical condition present, yes.
Here. And then document.
Click save.
Okay. So now, ER time notified, is that what you said, notified?
Yep, notifying the provider.
Time. Is that it? You have to be notified at the time. Now, say. Okay, got that, Davis?
Okay, we all document our notified time.
Okay, so Marcy's just finishing. Nick?
That's all I need.
Say.
We're getting medical, I mean, yes.
Okay, let's go ahead and document that we cleansed the wound.
Okay, check it, insurance, check it. And done. Now, write in there what you're gonna do.
Don't forget to input your instance type or your location of your wound again if it didn't default in.
What about the Beta Pep or all that stuff, Chlorosep, or is that just antiseptic solution?
That's what I
Okay, so
marked.
you got it.
Yeah.
Okay.
You can do more than multiple. You can put antiseptic and water. You got the squares, you can check more than once.
Inside.
Okay,
All right.
we got a little time to kill, so let's go in and update our tetanus vaccination status. Or review anyway, confirm with the patient. Does everybody remember where we're gonna put that in at?
Summary.
Summary. Everybody should have it inputted since we put it in last time.
Say you need it. Got it?
So you go in there to look at it again?
If you can see it, can you see Mary?
Okay, we reviewed our immunizations. We're still waiting for the provider.
Do you have to like confirm it again?
You don't have to confirm it, but I am asking if there is that option. I think it would be nice just for that timestamp that we reconfirmed it, but this time I don't know if we'll have that ability or not. This might be just a matter of just reviewing that there is something present.
Cancel is what I did, Mary.
Okay, so we're still waiting for the doctor to come, so we're gonna complete our past medical history while we wait.
I was
Does everybody remember how to view
How to
our
do that.
previous past medical history? Patient care. History, right? Should have a couple positives in there. From last time, you could go through this list, say this is what we have. Is this still all current? Are there any additions?
Right here.
Okay, I see.
Okay. Are they okay? How they doing? Anything else? We got enough there, don't you?
Okay,
Okay.
so let's go to actually document our plan of care. So we're gonna go back to the work list.
Okay. So you're gonna document on the chart.
Click on past medical history,
Check on it. Document.
document. Now, everybody should
Yes,
have
yeah,
a previous
yeah.
past medical history entered now from before. So I want you to push the recall button.
They're all loading still, all of them.
Okay.
So. Okay. Alright, so now you all push the Mary, push your recall button. There, did you, Marcy? Yeah. Okay.
Okay.
I think you're all there.
This first diamond is going to recall just this question right here. So if you push this first diamond and it's no, and there's no changes, you can go on to the next one. Okay? So go along here, recall your previous answers.
You all see it?
If you get a yes within that question, you can open up the whole question by pushing this diamond button to the far right. And that will open up the whole question set. Okay?
And you have to do that if you have a yes.
To confirm, yes, yeah. So go ahead and go through the past medical history again. This time I would like for you to put in 2 additional new past medical history items.
Find out something else that's wrong with you. You did the respiratory and heart last time, that the nerves or something, you know, that's what she means.
Are you kidding me?
No. I'm not.
Just keep scrolling, it's just gonna keep going.
So I just push that.
Two more new ones,
Next scrolling to your next section.
so you'll have to change one from no to yes. Don't change your yeses if you already have, we're just gonna add 2 more yeses.
Okay, here it is.
I got two right here.
Okay, well, if you already got 2, but she wants you to add 2 more.
I added those two.
Okay, you did add? Did you fill out all the extra questions to go with them?
All the questions. Is there, no, I'll change.
Oh, no, you had one muscle skeleton, you remember you did that. No? You gotta get
Well, you're
somebody-
saying add 2,
Add some new ones.
like if one was no the last time, now change it to yes, or?
Or just, you don't have to, I mean, just add one new yes to a past medical query,
Yes.
past medical history question. So essentially the patient is telling you, I have this new now this time around.
So how about this? You have any, blood resources?
Okay.
Say yes.
So this company's good. It doesn't show me this no.
Well, let's see where.
So then we just save after we've gone through it?
Yep.
Missing required sewage. Okay. 14.
I think we're okay now.
Everybody caught up?
Yeah.
Okay. Let's go in and document now our physician has arrived. So we want to document their arrival.
ER time.
ER time.
You're right. Where it's at for sure. See that? You see it, Jeff? And if you should talk down if you got the clock.
What'd you put for the notified arrive comment then?
Didn't put one.
Want that do something?
It's not always applicable.
Well,
Okay,
it's just for the
save it.
time to see,
That's all you
oh,
got.
never mind. I was looking for the arrive time.
Oh, seen by provider, that's,
You okay, Mary? Yes. As soon as you get time in there, save it.
okay. So let's say a couple minutes have lapsed, the physician saw the patient and he wants the patient to have an x-ray for whatever reason. Say they're gonna x-ray the location of the laceration, it's deep enough, they need to double check. So we wanna document, the patient going to x-ray.
Oh, because we don't have to order that.
Oops. Uh-huh. Good deal.
Good job, Mary.
Yeah.
Yes, we will need to order that. Let's go ahead and place the order first, how about that, and then we'll go back and document our patient went to x-ray.
How do we order an X-ray? Orders.
Go to orders,
Okay. Next, okay. Let's go through that one. Okay.
now you will see new sets is what's gonna pop up. We're not gonna have every type of x-ray order listed in our set, so in this instance, we're actually gonna wanna go and select our individual x-ray that we want to order. Okay? Does everybody remember the location of their laceration? We are gonna go to current orders, new orders, enter in your ordering provider. You can search by name, any word.
Anywhere. I think that's right way. Just try it, Sharon.
Now,
Sorry. Yeah.
anybody having a hard time finding an x-ray to fit their laceration location?
See, here's the femur, and I'm on the side. So.
Here.
Femur. See if it's the right side. You want the side view and the front view? That would be two views. Okay? And you have to look reason why. You always have to reason why. That one.
Firearms.
Oh, yeah, I remember which one.
I put firearms.
Bless you.
So you have to do CT? Now, you should be able to fill that, right?
You're having a hard time finding the location. The RAD orders are set up according to bones. So if it's an arm, you're probably gonna wanna search for humerus, or maybe, I can't remember, I think it's
Forearm's
forearm
on
on there,
I
forearm
know, I
maybe
can't
on there.
find arm or forearm
Yeah,
or.
forearm's on there.
What?
If you can't find what you're looking for and you wanna see what's actually available to pick from, if you pick from category group
Yeah,
and go to imaging here in X-rays,
did you get it there?
do the drop down, then you can search through the list that way too if you're having a hard time finding what it is you wanna order.
Did you girls get that category thing?
There's not too much to choose from.
Did you find it? What are you girls trying to do? Okay. Oh, they're doing
You're
something.
both covering your heads.
I don't know, they're trying to guess, I guess, or something, I don't know. You sure you have to put the reason in, Mary? Did you put yours in?
No. Humerus. Put your what?
Well, you were like,
I was hitting it, I couldn't figure out what it was. Okay, no, where do
Okay,
I
what's
got
I put your
here?
reason?
I can't read it.
Okay, let's see.
Oh, wheelchair. Reason for exam, straight.
That's the last page. And enter. Enter.
Enter.
And then you go, I need to say next or something, because that's the last
Oh dear.
Everybody have an order?
Yep.
Been submitted, says ordered in your status. Okay, let's go back to our work list and document that our patient went to X-ray. When you document this, I want you to go in and post time. So we're documenting this after the patient's already gone.
And done.
Do you remember how to change your time for your documentation? You're gonna click up here in this drop down. It's gonna default in the current date and time. We want you to change it to 2 minutes ago.
Janelle, where are you at?
Okay, hang on, I'll help you.
Couldn't you change your time to
document it
radiology,
here.
I mean, you know what I mean, instead of changing that time to
So
document
what
it
are you
first?
changing it
You're
to?
gonna, why don't you refresh?
Like
It goes
2
down.
minutes ago.
Okay, so you're gonna ER nurse
Like a time to
document.
radiology, can you just
Is that a
put
glass
14:20 or do you need to change the time?
And document it,
And
and she wants you to come up here.
Yeah,
change the
yeah,
time.
you- technically probably
And
do.
then change it, she said 2 minutes before this one. So you can just click on it, and 14:20, okay, and, okay. Times 14:20, okay.
That's it.
And then, we return from, time returned from radiology. All right, you see, here's return from. No, that's time to radiology, so this is time returned from. Okay, and then, say, got it there?
Yeah.
Okay. Uh-huh.
Oh,
Good,
did
That's
we
where you want to
return?
put this time?
Yeah, you got returned,
And then just split,
returned, okay.
right?
For the same time.
Well,
You don't have to put that.
well, that'd be 14,
14, 20, 21.
so.
Can you just put patient to X-ray and you'll put for wheelchair and do that?
It's part of your documentation. It should be in there. Did you see?
You took wheelchair before.
Yeah, I
So
see
you
that.
tried
Type
to
it
get
in,
it,
right?
okay.
Just type
Same.
under the
Change
nursing.
order to.
No, here in your ER time document, transport mode is listed for you. Did you document a freehand note?
Yeah.
Yeah, that's okay. Yeah, you actually will document your radiology times in
Came back
this
from
information.
radiology, time to radiology, 14:20, and you're supposed to return from radiology, so anyway, okay. I know, this one.
But you won't do the return until they read.
Yeah, you got it.
Right, more than likely, you're gonna have 2 entries. You're gonna document when they went,
It's okay.
then you're gonna document when they return.
Yeah.
And back, so they're gonna be screwed, no one's gonna check it and say.
Okay? So patients return, we'll say they've returned, and now the provider has sutured the laceration, so we want to go in and document the closure of the laceration. Does anybody remember where we're going to document that at? Yep, in your laceration assessment.
The last ratio assessment. Cheryl on the side there.
Document.
There, check.
What did they use to close the laceration with?
Duct tape's not on there.
Sounds good.
Just pick some, Cheryl, she'll tell you. With lead bleeding
So then, like,
control,
when you
yes.
write that they're, doing lidocaine or betadine or whatever, you have to put that in your notes, is that what?
You know, we could add that as part of this, then you wouldn't have to. We want to try to get away from as many note sections as possible. So we could add, you're thinking like the, well, the Lido, you're gonna chart from your MAR.
Like the betadine swabs and.
The betadine, we could use, yeah, we could put that in. We could probably just put that in as part of this laceration assessment, then you don't have to document it separately.
Okay.
For dressings.
Sometimes they irrigate with saline water
But
too,
we
would
have-
you?
We have a dressing.
Sometimes
That's
they'll
already
take
on there.
sterile water and irrigate with it too. Can you put that on
That
there?
was already on there somewhere.
Oh, was it? Okay.
That's cleansing.
The cleansing wound.
Okay.
Yeah.
Okay, I'll make sure you save it, Cheryl.
Okay, so we've documented they
Did you
closed
sutures
it.
and what you're doing? Did you pick staples? Okay, then save it. There you go. Good job. Save it.
And now we want to document that we've applied a dressing. So dressing application. Document.
Yes, dressings? Don't have- You don't have dressings?
No.
You don't?
Find that question? That's right. Did you have your?
Did you cancel it off your list by mistake, maybe?
I think so, but.
Where's Penny? It looks like it's on there, so I don't know if because it's highlighted.
You go to change view and view completed, I bet it's there. You would probably, or go to cancel, look at canceled items, it's probably been canceled.
Where's the date? Okay, now that's the date.
Okay, we all caught up?
No, should be done just a minute.
Okay.
Okay, thank you.
Okay, so we've dressed the wound, we're getting ready to discharge the patient. We need to document our dismissal, vitals, GCS, and pain. So you can select Glasgow Coma Scale, you can select pain assessment, and you can select vital signs to document all of those prior to discharge.
And done.
And then document at the bottom.
And they're all on the same sheet, so it's nice that way. Okay, we'll just document on Cheryl and Cheryl and you.
Well, if it's not within the law, it's within the law. Even when I put a no on pain assessment within normal limits, then it says patient denies pain. And that's been in there the whole time.
A normal pain assessment, so to say, pain assessment within normal
Well,
limits.
that's what it says, and there's a yes or no.
Right.
That's
But-
just
So
tell
you're
me what-
answering this question, is the pain assessment within normal limits,
Yeah.
yes or no?
And you say yes, and it
Well,
would be,
yeah, I put yes, and it says
That's just a
patient denies
description.
pain.
that's just what you're
That's just
answering.
describing what normal limits means for pain assessment,
Okay.
okay? So if you say patient, pain assessment is within normal limits, yes, you don't have to document, they have no pain.
Right.
Yeah,
If you would say no,
Then you do.
it's
Now
not
Yeah,
then
within
you
it,
go to this add a pain
yeah,
location.
then it gives
Right.
you numbers.
Gotcha.
Okay.
Mhm.
Thank you. How you doing, Cheryl? Going okay, Karen?
Okay, the last thing we need to record is their INO. We do record intake and output. This patient had no INO, so we do want to go in and document that. So we're gonna put zeros for intake and zeros for output.
You finishing up, Cheryl? We can skip some of that stuff. Just say. We gotta go. We gotta let you go. Yeah, no, she wants to, I know.
No, we don't declare these tasks out when we dismiss them, do we? Is that the same thing with the floor too?
Zero, no, I didn't think it was zero. Just say something on it, I guess.
Okay, so we've documented everything on this patient. We're essentially ready to discharge them. We really didn't have a need in this instance to add a nursing note. We were able to capture everything in our documentation. So you can go ahead and your status due column and cancel out the ED nursing note. And now we're ready to discharge our patient. So go to the discharge tab. Select the type of instruction as the laceration dismissal instruction. Click OK.
What if you wanna put in for like risk, like a risk for infection sort of thing? Can you put another one in there?
Yeah, you can do this drop down and add another. I don't think we have a risk for infection,
I
but
don't think we do.
Cause I mean, when I click on it, it doesn't want to, it won't let me. Okay, go to look up,
yeah, you can try to search for what you're looking for.
okay.
What I found was easiest to go is to go by category. And you can look at the type of instructions we have built. So like head or brain, we have these built. Cardiac, dermatology, so you can look that way too.
Okay, yeah.
Let's have them follow up in 10 days for suture removal.
Did you pick your doctor's referrals, in 10 days? For suture. Now, how do you add your little note? Remember, you gotta go over there and read your little writings on the side of the doctor referral. That little Julie Bopper over your book, you got it? right there. And it invites you up 10 days, suit your need. You looking for something, Mary? So you get it? Okay, you gotta go your
Everywhere
referral.
else is to be.
There, you got your doctor.
Trying to find Roger, but he's
Oh.
going next.
Yeah, next. You just go next until you find it. Are you girls doing okay?
Yeah.
Satchers, okay. And then you gotta put your, your sutures in 10 days. Did you get it in there, Cheryl? We got your English, okay. We're waiting for everybody to get kind of done. They got a little bit left and we'll be ready.
So like, they're gonna do prescriptions and,
It'll be the same we do now, they'll write a script.
okay, we don't
You
do
sure
it
you
down
get your
here.
language in there, Mary? There's the bottom, the language.
So we'll still make a copy of the script if they write one out.
Okay.
Okay, discharge data.
Oh, we have to save that or not?
Save this.
No, you can save it on the next screen.
Okay.
Okay, we'll go to discharge data, that one on top, the other one.
Disposition home. Condition good. Discharge date and time is grayed out. We have not registered our patient yet. So we're gonna say save the discharge data.
Yeah, it's not, it's still not discharged. Be sure you saved though. You all saved?
I wanna see, I was
Okay.
trying to figure out.
Go back to the tracker. Make sure you have no open charts down here at the bottom, okay? Highlight your patient in green. And register your patient.
Molly, you want to be married, divorced, single?
Let's see.
I'm freeze white and 21, ha ha ha.
We have to do all these clear across, right?
Yeah, just go through the asterisks again.
I noticed there is an SP mnemonic for self-pay, Sarah, in that insurance.
I think that's the same patient, because if you type SP and enter, it drops down the same patient.
On the insurance screen though, when you type, here, a second.
Which one is it?
Because I did that for,
Alrighty.
Yeah,
but in a different, oh.
in this
there, I see.
field.
Oh, okay.
But yeah, you're right, in other fields, if you're trying to input a name, if you do SP, it'll pull up same as patient, yeah. Lisa, you can go ahead and discharge your patient.
I'm just gonna say,
I tried to enter self-pay after like the initial one, and then at the end it says self-pay patients can only be administered or something as the primary.
Oh, really? So they-
That's not right, is it?
Mhm.
you wanted to say Lisa.
Cause they always had it afterwards.
Maybe they're changing something
Self-pay
and
insurance can only be entered as primary insurance.
maybe they're changing something in that process.
Registered.
No,
In the discharge stuff.
Okay, and did you put the date and time when you were registered dismissed
No,
on that second data sheet? Go back to your tracker, your chart.
because I already know.
I know.
I'm sorry.
Wouldn't it prompt me if I
go to discharge.
Mary, you can discharge your patient,
Discharge data.
and Chantel, you can discharge.
Put on your date.
Oh, okay.
And I'll hit save.
Okay, I'm lost, I don't know what to do.
Did you already discharge yours?
I just did for
No, that's
discharge.
fine.
Where'd you go to? Open chart and refresh. Cheryl and Kate are off now, I think. Now, are you girls still doing yours? Go up?
Well, I gotta,
You're ready for discharge. Oh, you're not ready.
where do I go
You gotta
now?
go back to registration. Did you get your registration done?
Yeah.
You said it does, but it says where you at.
Oh, you'll figure out.
Yeah. Where you at? Does it say register?
Right here, ready for discharge. That's what it says.
Okay. I would go tracker
That's what mine says too.
and open your chart. And then go to registration. Because it must be, okay. So we got their chart open. Okay. So let's just go through discharge. Add it there. Now, so you went, you're pretty sure you went through
data.
everything? Yeah. Okay, then let's go to data. It's received, so see, it's not right. It's gotta be registered.
So
Okay, so
what-
what are we gonna do? We're
So
gonna go
go
to the
back
tracker.
to,
Show your chart. On Mary, where Mary's at.
I don't want, I pushed ready for discharge by accident, how do I get it back?
see, that's what I did too.
Okay, okay. So
Is it-
now,
the
we're gonna go
ones
to
that yellow.
registration. So tracker and
You've got your
registration.
patient registered, so just go ahead and open up your
Okay,
patient.
now, is there something that you haven't done? Just go through and see.
Oh,
Okay, and just go next, just go next. Did it say that? You have to do it in like format, like a social security, like 444.
Oh, I'm right
Two,
here.
three, and
I registered, but
444.
why isn't that yellow? Should I
Okay,
get it
next.
No?
Probably once it flips to 1 hour
Those.
and 1 minute, it was
Those.
yellow.
Oh.
But anyway, you're still, is this
Next.
you?
Try next.
Where am I?
Yeah, next. Registration.
Okay, you've got yourself
Yeah,
opened,
money.
so you've got
Next.
about 3 different charts opened up down there, so
Next.
go ahead and
I think, I can't remember what occurrence we
click on this patient.
I can't remember, should I forget?
Disclose name.
Okay.
And just click on this.
Next one.
Go ahead and
Go
close
next.
that one out.
Here?
Now, primary care.
Okay. See what else you got open here.
I
Okay,
can't
going to
just
status
this
quo.
one, I just, I don't want to play along.
Okay, now open your chart. There's yours.
So I'm still ready for discharge again, next.
So you can go to the discharge tab. And you want to enter in a discharge date and time. Remember how to get there with your gas.
yeah, in there.
Oh, that was.
Take it off? Actually, take it off.
No, I don't know for sure.
Ready to
Save.
Okay, so now we're gonna, okay, we're gonna go up here.
Flip back to your tracker. Tracker. And hit refresh.
Okay, so we don't have this. So, we want to dismiss, right?
Oh, wait a minute, did I
Go
Maybe
away.
refresh.
register now?
Still open.
You're waiting
Yeah,
on
I'm ready.
Yep. Okay,
Oh.
so let's go track on that.
You should, no, that's okay, that's
Now
just
it's right. Just turn it. Brushed it, right? So I'm gonna just track that. Push it down there. And here, there. Now put in your date. Put it in. Just click on that. Okay.
Discharge, no, no, no.
No, it won't, because she's still received.
You need to just X out of that, Mary.
Yeah.
X out of this chart,
Top.
close that chart out. Okay,
Do you have
you're
to-
registered,
Yep.
so just click refresh for me. Okay, now move your bar over so we can see if your chart's open. Okay, now go ahead and open up the chart.
Did you click on it? Yeah.
Alright, go to your discharge tab. Now discharge data. And enter in your date and time.
No, it's easier. Hey, it is church.
And now click save. Refresh down at the bottom.
Did you get yourself a person? Good.
Refresh.
I went over and said this.
Oh, so now I'm off there.
You're still displaying that track for those. Refresh. Make sure you fall off of there.
You girls get yours off, Stacy, get yours off.
Yeah.
Okay.
Okay, everybody can take a break.